Hi everyone, I just wanted to start with a brief disclaimer. This presentation is a student presentation, so this highlights a hypothetical scenario and it is not promoted by or representative of an agency or professional entity, and it does not necessarily reflect the views of said agency. And I just wanted to start with this before we begin. Hi everyone, my name is Savannah Hickman. I'm currently a student of the Post-Baccalaureate program here at UAMS, and next year I will be in the dual MD MPH program. And I wanted to present to you guys today a really forward-thinking program, in my opinion, with some really interesting topics. So the essential idea is that high school students who are interested in becoming pediatricians can attend interest meetings where they essentially learn educational and really valuable information about things that they'll really need to know and utilize as pediatricians. And what I'm going to focus on here is common exposure risks for children, including injuries, and how these can really impact children's lives all the way through adulthood, and how important it is as a pediatrician to be able to recognize these things and to be able to appropriately treat them. So a few of the topics I'm going to be focusing on for my presentation, one of the most important one in my opinion, and the very first one will be a foundation of what it means to be a special populations category and how children qualify for that category and what that means for children specifically, as well as what that means for pediatricians when treating those kids. At the same time, we're going to be focusing on some history, just because special populations categorization is not necessarily a new idea, but the way in which we look at special populations and risk factors in each individual special populations category has changed a lot. And so previously it was kind of all treated in a similar vulnerability way, but now we are really focusing on understanding what the differences are between those special populations and how each of them can be impacted in different ways. And finally, just some current research practices that can reduce exposure impacts on children. So in addition to kind of going through what those basic exposures are, what the most common injuries are, just exposures that include some traumas that can stay with kids for the rest of their lives, physical or otherwise, we also really want to focus on how we can mediate those things and what, as clinical professionals, these high school students in the future should know and should be able to do to really impact their patients and help, again, mediate the effects of these exposures. And finally, a few of my references. So first we've got PubMed's article, An Overview of Children as a Special Population, Relevance to Predictive Biomarkers, and this just kind of does an overview of what those special population categories are in children, physiological or otherwise, and also kind of highlights how researchers and clinicians can use biomarkers to see what kind of exposures children have had, and maybe as adults, track how they responded to it, which is crucial for understanding them as a special population, children as a special population better. NCBI's article, Special Population Considerations and Regulatory Affairs for Clinical Research. This, again, a big highlight in how clinical research is being conducted and what we are currently changing as far as focusing on specific things that are risk factors or things that were not previously considered risk factors, but definitely have been known to be exposure factors for children now that we recognize, and how going forward we can better research what those impacts are on kids. NCBI's article, A Review of the Field on Children's Exposure on Environmental Contaminants, a Risk Assessment Approach. This one really does focus on, we know what the exposure was and we know what the risk of that exposure is. Now we need to track how children responded to that and what we can do to kind of, just stay on track with that and see how to mediate things like that in the future. And my last one is Science Direct's article, Early Life Environmental Exposure Determinants of Child Behavior in Europe, a longitudinal population-based study. And this study, as we all know from the definition, is a longitudinal study, so it's following kids throughout their lives, and not necessarily start to finish, but for a significant amount of time to record, what kind of exposures they may or may not have had, and how essentially their lives turned out, and what kind of physicality they are showing well into adulthood, how their mental health developed, all of these things. They can really track a lot of development components through something like this and kind of see what different exposures can do to different people. And so this is really, really important. And that's all I have for you guys. Thank you.